Hello and welcome. This is Pam. Today I'm going to be sharing some really important research with you, really adding more evidence to what we know is that multiple sclerosis is caused by a parasitic infestation. And so this research helps to validate that. I'm building this mountain of evidence, and it's really exciting to see what we have known for years in these two drugs. So we're going to come around full circle with this, but first of all, you're going to understand why diabetes medications help multiple sclerosis and how this also adds more evidence to knowing the cause of MS, which is caused by parasites. And when we know the cause, we know that we can recover. If we haven't met yet, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And by the grace of God, I have lived now over 35 years free of multiple sclerosis. And also by the grace of God, I have developed a program to help others, and he's been really sharing or opening us up to a whole world of research. So what my goal is to give this research to you so that you understand that we do know what causes multiple sclerosis. There is a solution, there is an answer, there is a way to recover, to get your health and your life back. And today's evidence shows even more support for that. So I'm going to talk about a study, but later, if you want to learn more about what I'm talking about, make sure that you go to livediseasefree.com. Make sure that you subscribe to our website, because then you're going to get our newsletters, which we send out every Friday. You'll have my notes. You're going to see other studies if you want to look at it. And this is really great to share with other groups. Also to share with different practitioners. So important to share with practitioners, because this is truly how we're going to bring change. Otherwise, this evidence, if it's just hidden, nobody will ever be able to bring change. So let's talk about the study. The study is called Immunological Effects of Metformin and Pioglitazone, good tongue twister, treatment on metabolic syndrome and multiple sclerosis. And so I'll talk a little bit about the study, and then we're going to talk about why diabetes medications are helpful for MS. And then I'm going to share with you an alternative to these medications that's a lot safer and does not give you any type of adverse effects. And then after that, for those of you that are really wanting a plan to treat these parasites, I'll share where you can get more information on our step-by-step plan of how our students are recovering from multiple sclerosis, so not just myself. So this study looked at two common diabetes medications, metformin and pioglitazone, and they can significantly reduce MS activity. But the real discovery is not just about the drugs, like that they're diabetes medications, but what they do for multiple sclerosis, like how do they impact the parasites that are causing MS. You'll find this really, really fascinating. So what the study found, so they looked at 50 obese patients that were diagnosed with multiple sclerosis, and they broke them up into several groups. They also had metabolic syndrome, and they followed them for 2 years. So it was a fairly long study. They divided them into 3 groups. So 20 participants were given metformin. Again, so these are people that were diagnosed with MS, they were obese, and they had metabolic syndrome. 20 of the 50 received metformin, and 10 of the 50 received this pioglitazone, and then 20 received no treatment at all. Like they didn't get any diabetes medications. And so this is important. You want to have a control, because you want to see, like, if the person didn't receive, and if they're a cohort similar where they have the same diagnosis, they're obese, they have the same metabolic syndrome, the only variable you're changing is whether they received the diabetes medication or not. Again, this went on for 2 years. And the researchers tracked brain MRI scans, immune function, and hormone levels. And they found some striking information. So the people that were on these 2 diabetes medications, they had reduced brain lesions after 2 years. And so this was where when you look at metformin, at the metformin group, the people that had multiple sclerosis that were given metformin, their T2 lesions dropped from 2.5 to 0.5. So from 2.5 to 0.5, which is a very significant drop. So both metformin, both of these drugs, they showed a dramatic decrease in new and active brain lesions. The other drug, the Pioglitazone, that group that received that drug, their T2 lesions dropped from 2.3 down to 0.6. Again, a very significant drop in these T2 lesions. And then the gadolinium enhancing lesions also dropped to nearly 0. So these are not little changes. These are really big changes over 2 years. They also found that there was better immune balance. So they looked at things like leptin, which is a pro-inflammatory hormone. And it's a pro-inflammatory hormone, and they found that that pro-inflammatory hormone decreased. They also looked at another anti-inflammatory hormone called adiponectin, and that increased. So that's an anti-inflammatory. You want that to go up, and it did go up. And this is in the treated group. And then the inflammatory T cells, they dropped significantly, and the regulatory T cells, those are the ones that just kind of work at modulating immune function, they increased. So we want the regulatory cells, the immune modulatory cells to increase, and they did. And we want inflammatory T cells, those are the ones that are fighting infection, and they decreased. So these are really major changes in lesions, but also in the immune function by giving MS, especially obese MS patients, these two drugs versus not giving them these two diabetes medications. So then you might think, well, like, how is MS linked to diabetes? Like, what is the connection here? Well, both of these medications lower blood sugar. So in all of the research, they're kind of like, no, we don't want to consider that. We want to look at, like, what are all the changes that are happening? Like, your T cells, the regulatory are up, and the inflammatory ones are down, and inflammatory hormones are down, and anti-inflammatory hormones are up. And so the drugs are just changing the immune function, and they're changing, like, the lesions produced by the immune system. But when you actually look, number one, they're telling us that MS is an autoimmune disease where the immune system is attacking itself. And then so it's kind of like, okay, so what are the mechanisms, right? Well, when we look at the mountain of research that I have shared with you, that MS is an infectious disease where we found filarial worms, by Dr. Alan McDonald found filarial worms in the central nervous system, and then also tapeworm larvae and developing tapeworms in the central nervous system of MS. Over 100 years of research showing Lyme disease, over 100 years of research showing protozoa similar to babesia or malaria. So and then also the fungal component to MS. So there's this mountain of evidence that multiple sclerosis is caused by dysbiosis, by a parasitic infestation. And then these two drugs, they decrease blood sugar. And as I've shared with you, in science, they know that parasites love carbohydrates and simple sugars. That is their favorite source of energy. So when you decrease food to these parasites, they're going to be less active. They're going to produce less poisons. They're going to be less work for the immune system. And then you have immune modulation. You can get decreased activity in lesions. You can have less lesions, right? Because they're not going to be thriving as if you were feeding them, especially for people that were obese and had multiple sclerosis. Obviously, they were probably eating a lot of carbohydrates and a lot of sugars, and we have cravings, and the parasites make us crave sugar like crazy. So that's the exciting thing, is that to understand why diabetes medications would be helpful for MS, and it's not what you think, or it's not what they're trying to tell us. It's not that, oh, these drugs, they suppress the immune system, or they modulate the immune system. No, they are decreasing the food to the parasites. The immune system is working less, and there's a decrease in inflammation. How do we know this? Because for years, we have worked with hundreds and hundreds of students all over the world. And we've been fine-tuning and perfecting our diet, the Live Disease-Free diet, and we really see dramatic changes in people's symptoms by decreasing carbohydrates and simple sugars. So we're not doing it with a drug. We're just making different choices to foods. And when we do that, we can have more symptom improvement than any MS drug could ever offer us. We do want to treat the parasites also, but it is so important to understand that the reason that diabetes medications could be helpful to MS and many other diseases, because all diseases are caused, the biggest cause is different types of infections, parasitic infections. So the biggest reason is you're decreasing the food to those parasites. So different types of parasites would include fungi, bacteria. These are all pathogenic fungi, pathogenic bacteria, worms, and protozoa. Those are the four main categories of parasites. And a parasite is anything that lives in your body and causes you harm. So they eat our food and they eat our nutrition, and they're freeloaders. So when you decrease food to them, they're going to be more quiet. We still want to treat them, but they're going to be a lot more quiet. So both of these drugs are known to have anti-inflammatory properties. They work through different pathways in the body, but they have nearly identical improvements in multiple sclerosis. And their main fact is that they lower blood sugar levels, right? And that is the key throughout the body. They're lowering blood sugar levels. So this research strongly suggests the real benefit isn't from the drugs themselves, but it is truly one thing in common: decreasing blood sugar levels. And before I go on, I just wanted to share with you that I have the Live Disease-Free Diet Guidelines on our website for free. You can just go to livediseasefree.com, and there you will be able to go under, in the main menu, look at research, and then click on the Live Disease-Free Diet Guidelines. And that is my gift to you. This is from years and years of research, working with many, many students, what works for them. And it will help you to start seeing the power of eating low carb, because that is truly why these diabetes medications are helpful. The problem is that when you use these diabetes medications, they have horrible adverse effects, which we will talk about. So let's talk about their risks. So for metformin and the pioglitazone, they do help to lower the blood sugar level, but they do come with risks. So for example, metformin can cause things like nausea, bloating, gas, diarrhea, also common signs of lactic acidosis. We've talked about that before, like especially the infections cause this lactic acidosis in us also. And then vitamin B12 deficiency. It can also be caused by metformin use. And this can cause nerve damage and memory loss. And it's also, the use of metformin is linked to cognitive decline and also Parkinson's in long-term use in people that are over 65 years old. So when we're diagnosed with multiple sclerosis or another neurodegenerative disease, and then we're taking this drug that can amplify certain nerve symptoms, that's not really helpful for us. We want to, so sure, it's going to decrease lesions, but again, how can we decrease the blood sugar without side effects? And that is the Live Disease-Free diet. So I would really encourage you to go to our website, livediseasefree.com, under research, look at the guidelines. I've got a cheat sheet you can print off, you can put in your kitchen. There's a 3-minute video that summarizes the guidelines. Then there are some longer videos that I've shared what I eat for breakfast, lunch, and supper. So you'll have lots of different ideas. We have holiday meal ideas. So there's lots of options that you'll feel satisfied. You will love the taste and the flavor of the food, but you can notice significant improvements. But it's really important that you get your blood sugar down low enough. If you're eating more than 50 total grams of carbs per day, you may not really notice a difference in your symptoms. If you get your total grams of carbs down to 30 to 40, like closer to 30, it can be life-changing, absolutely life-changing. So I just wanted to share with you like one student that's quite new in the program right now. And she found me and she started changing her diet. And she doesn't have MS, but she has a lot of other health issues and has been very, very sick. She was bedridden for years and just not being able to function, like not being able to participate in life, just barely coping by. And so just by following the diet, before she joined the Live Disease-Free plan, she was out of bed. She was able to get out of bed. She was able to start doing things again in her life. She also said, I can read a book. My cognitive function has improved so much that I can start reading. And then I just got an update from her yesterday because we have our live Q&A call for the Live Disease-Free plan on Tuesdays. And she shared that her mental clarity has been the most amazing improvement. She said, I thought I was losing my memory. So this is really good news for us that are dealing with memory issues, that the brain can heal. We've had several students that were in brain studies, and once they follow the diet and they treat these parasites, their brain function becomes above normal. They're kicked out of the brain study. So that's the nice thing, is your brain totally can heal. And she said no more anxiety attacks, which often led her to crying, to tears. They're gone, she said. And I'm no longer getting up in the middle of the night to urinate. That's a big one. That's one of the first symptoms that we notice when we go low carb, is that instead of getting up multiple times throughout the night, it might be once or twice. And that's a huge shift, because then we can start sleeping, then we can start feeling more human, then we can start healing. She's already been able to come off one medication. So this update that I gave you, like first she followed the diet, not perfectly, just what I share on my website, livediseasefree.com, and that helped her to get out of bed, to be able to function, to be able to read books again. And then all these other things are just perfecting the diet properly, and she's using that oxygen. I think she's doing the oxygen enemas. Yes, I'm sure she is. So she hasn't even really started treating yet. So I'm so incredibly excited for her. I'm going to go to your questions. Hi, Janet. Hi, Kay. Paulette, will the diet help with irritable bowel syndrome? Yes, it does. So with irritable bowel syndrome, like, you have to listen to your body. Like, because we have parasites, so irritable bowel syndrome is caused by a disruption in the microbes in your intestines. So you have parasites, and it depends. Like, if you're really constipated, then, and you tolerate raw vegetables, you can eat them, but the low carb vegetables on the shopping list, or the cheat sheet, I should say, that's on our website. But if you are, let's say, every time I eat vegetables, Pam, I get terrible gas and pain when you're eating raw vegetables, then it's important to cook your vegetables until you have that settling down. So number one, you can saute, steam, oven roast, or stir fry the vegetables that agree with you, that are low carb. And you'll find that your bloating will go away. Of course, you have to support constipation until you're done treating, because the parasites are making you constipated. But the irritable bowel syndrome is really from the parasites, and this diet will help the symptoms. But if you want to fully recover, then you also have to treat parasites. And the nice thing about irritable bowel syndrome is definitely not, you're not dealing with as much of an infestation as somebody with multiple sclerosis. Like, as soon as you start getting neurological symptoms, like a lot of brain, head, and nerve pain, and loss of function, like, that means that you've got a fair bit of parasites in your central nervous system also. When we have irritable bowel, it's more in the gut. And so it's easier to treat. It's easier to recover from. Let's see, a couple more questions here. So Janet, any comment about the buzz surrounding ivermectin? I have been in this health journey for over 35 years, and we've seen a lot of things come and go. So ivermectin is an antiparasitic drug. It is really helpful for treating certain types of parasites. And it's not going to treat all parasites. It's only going to treat specific. You can actually look it up online. You can go to pharmacy websites. You can go to pdr.net, and they'll probably tell you which parasites it'll treat. So it's it is helpful, and it is often prescribed in recovering from multiple sclerosis, but not by itself. So if a person is dealing with MS, then they may test well for 3 to 5 parasite drugs. And yes, they're taking 3 to 5 parasite drugs, not all at the same time at the start, but they're using a strategic plan of, incorporating 2 or 3 at a time, and then building up to the place where you feel you can tolerate all 5 at the same time. So it is helpful. It's been really helpful for that thing that went around a few years ago. It is helpful for, I don't know about all of those viruses, but for sure that one for sure. And also certain roundworms and filarial worms and different types of parasites. Again, you can look that up. But it's not going to cure MS. It is not. And so it's just crazes that are going through. And so unfortunately, there are some healthcare professionals that are really telling everybody to go on ivermectin and fenbendazole too. And again, that is not going to cure multiple sclerosis. I'm sorry, it's not. Like you have to have an individualized plan, and you've got to use parasite drugs that work against the parasites or treat the parasites you're dealing with. And then we use oxygen and we use herbs and we do all the prep work first, right? We follow the diet. So that diet is so important. It will give you the benefits of drugs like metformin, but it is not going to give you any adverse effects. So we follow that diet first. We have tremendous symptom improvements. We support the body, daily bowel movements. We're sleeping really well. And we still work through other things too, like making sure we don't have mold in our home, reducing wireless radiation, looking at our blood work, supporting physiology. It's like a checklist we go through. And so as you go through all of those things, you're feeling a lot better before you start treating, just like this lady who's able to get out of bed, able to read, able to be organized. And even just with the oxidizing enemas and just with the diet, she also shared, which is crazy, that her, I wanted to share that. Oh no, I don't have it here. But basically she just said, like, her vision has improved, like vivid colors, like everything used to be grayish before. And now she's seeing like beautiful colors. It's so interesting. I want to do a little side thing here is that, and I'm going to do a talk about it, but we work with the most amazing, we call them the wellness champion students. And the insights that we're learning, like we just had our call yesterday, and one of the students, she has been passing tons of worms, and she's like, I am looking so much younger, like the years of aging are just melting away, and I'm looking more youthful. And that is the case is when we're really burdened with parasites, like it's in our eyes, we look tired, it's in our face, it's in our complexion, it's in our skin. We just look haggard. And as you restore balance in your microbiome, you bring back the good and you decrease the bad, then people look like many years younger. It's crazy. And then another huge insight that we just had this week in our group. So parasites will cause us to feel anxious, as this one student shared, but also depression, but also can make us feel uncomfortable with ourselves. So that dysphoria. And so in research, I found a study, and I'm going to do a talk about this, where a certain type of tapeworm from dogs, so we could get tapeworms from our dog, right? And we're not treating ourselves in North America, we're just treating our dogs, and they do pick up tapeworms and other worms. But those tapeworms, when they infected them in mice, this is an animal study, but still they're similar, like structure. It's crazy. Back in biology, we dissected rats, and it's like, oh, because you're learning about physiology, and it's like looks very similar to humans inside, but we're definitely different. But it's so crazy how this tapeworm, it increased 200 times like the estradiol, the estrogen, and it decreased testosterone in male mice by 90%. So the parasites will often try to change the terrain inside of us so that they can thrive better. And so, of course, if our hormones are thrown way off kilter like that, people could start to question, and then, society tells us to question our gender. And that could be another reason. So it might not just be all the xenoestrogens that from pesticides and other things that are in our water that are like acting like hormones, but it can also be parasites that are impacting our hormone balance. And so this is another thing where women feel like, oh, my hormones are off, and these doctors are giving them bioidentical hormones and things. And it's like the parasites are causing hormonal disruptions, and they are more active at certain times of the month. So the insights that we're getting are just so incredibly profound. And even like today, talking about like the diabetes medications, there are two different diabetes medications. They work differently in the body, but they both give similar results with decreased lesions, decreased activity of lesions, but also improved immune function. And what they both do is they decrease glucose, they decrease blood sugar levels. And again, like if MS is just an autoimmune disease where your immune system is attacking itself for no reason, then blood sugar shouldn't matter, right? It's just your immune system has gone haywire. And that's not the case at all. And so it is so profound. And then last week, if you didn't get a chance to watch last week's live event that I did, I talked about this newly discovered lesion, and it's a broad band lesion. And all it is it's just there's more white blood cells like barricading the lesion so that whatever's in the lesion, whatever infections, whatever materials coming from possible brain bleeds or whatever, that it's, because that's an area where the brain barrier, blood-brain barrier has been compromised. So it's just like a thicker layer of soldiers protecting the brain. And isn't that amazing? Isn't that an amazing body that it knows that it needs to bring in more defense there? And so again, that is more evidence because your immune cells, they treat pathogens, they kill, destroy parasites. And so instead of saying, you know, like, why are they there? Why are so many there in those lesions? It's not like for no reason. It is like, what is their function? And their function is to protect us from infection. So this is going back to common sense, but the whole healthcare standard of care has changed everything so that everything is obscure, and we really don't know, still today, we don't know what causes any autoimmune disease or any disease. We don't know what causes it. We go, oh, there's inflammation involved. Well, inflammation is your immune system fighting something. What's its primary job? It's to fight infections. Common sense. But that wouldn't work very well for the standard of care that we have, because they would have to decrease their spending. We wouldn't need all the different treatments we are having, and we could actually recover more quickly. And many of us would never even have autoimmune disease if we treated parasites early enough. So this is what we're up against. All right, so Paulette, so you said maybe you're going maybe once a week or 2 weeks. I'm guessing it's constipation. So that is caused by the parasites. They are inside our intestines, and they are freeloaders. They're eating your nutrition, right? They cause craving. So they can change our hormones, but they can also cause us to have severe cravings for their favorite food, which is sugar or simple carbohydrates and sugars and other carbs too. Okay, last question here. You fast, Ryan, you fast from 8 p.m. to 12 p.m. every day. You eat mostly vegetables, berries, and meat. How can I start the program? Awesome. So it sounds like you're kind of on your way with understanding this. So just know that we're really careful with berries. We can have a very small amount, but we definitely don't eat a lot because the parasites love sugar from berries too. But I'll help you with all of that. So if you are at the place where you believe in your heart, you're dealing with parasites, maybe you even talk to your doctor and you're really disappointed because they really don't understand. They look at you cross-eyed. They're like, have you traveled to another country? And you're like, no, but I treat my dogs and my cats and my horses and my sheep and all these animals for parasites. They're on our food. They're in our soil. Doctor, you need to get caught up. Of course, you don't talk like that, right? But it's just really sad that they have been brainwashed, and we're not using common sense. So then after you're done with this live event, you can go to my masterclass training. You will find a link to that in the description of this video. Watch that masterclass training. You'll be really excited because I'll share some research about specific types of infections that have been scientifically validated linked to MS. I'm going to share a lot of case studies of people that have recovered, and then also the steps we take to recover. So then if you go through that and you go, this is exactly what I need, you can fill out a form, you can talk with me, you can ask me questions, but we just want to make sure you're ready. So that's why you're filling out the form, so that you're just giving me enough information to know that you're ready. And then before we meet, you're going to get a pre-work email with the coachathon, and that's going to go into more detail. So you're really going to understand, like, how do I find practitioners? How do I access treatments? I live in this country. Can you support me? Like, all of that mostly is answered on the coachathon. And then from there, then when you and I meet, then I can just go right to looking at your health history, things you've done, ask, and then you really understand the program well. And then you can just start. And some people actually join even before they talk to me, but I will have a meeting with you, because when I work with people, I like to have that introductory call with them to really get them off to a strong start, where we make sure, what are the priorities to start with? Because when you start this journey, it can feel a little overwhelming. We can be like excited, but nervous, and there's so many different things to learn. But the neat thing is we take it one step at a time. And this is a skill you'll have for the rest of your life. So once you restore balance, you recover from whatever disease you're dealing with, MS or other, then you can make small adjustments to your diet. You probably won't want to go back to that typical North American diet, but you can have more fruit. Then once the parasite's been treated effectively, you can have a little bit more carbohydrates, but you'll see what works for you, right? You'll see in your life with your busyness or the stress that you carry. Like, some of us are really high achievers, and we're like, I don't want caffeine in my life anymore. I don't want alcohol. Like, I'm getting older. I just want to keep up with my 7, almost 8 grandchildren, and just had a baby horse today. I'm just like, I had horses when I was like 20 years old, and I have put my life on hold for years. And so now I'm not going to be like a professional rider or anything, but just breeding an older horse and getting back on the horse. And so we have this little colt today that he's just healthy. Went to the vet to do that because I don't have experience. But these are the things you can start doing when you start to recover. You can start dreaming again. You will do things that you never thought you would ever do. I'm trained as a teacher. I never in a million years thought I would be doing this work. Again, it's by the grace of God that we're doing this work, that we have this information, that we have this wisdom. And this has been the first 10 years. The next 10 years is going to be taking this to the practitioners, is really giving it to them in a very concise, easy format so that they can catch up with all of our experience that we've had. We want this to go back to the doctors. We want this to be part of our healthcare system. We want an honest healthcare system. Okay, I'm going to let you guys go. So make sure if you have any other questions, type them in the question box. If this is all new to you, then go to our website, livediseasefree.com. Look up the Live Disease Free Diet Guidelines, start to implement it, and report back to me if you're noticing symptom improvements, and just make sure that you track your total grams of carbs. You can use a free app on your phone, the Chronometer app. It's life-changing if you follow it properly. It's not hard, but you just sometimes need a little bit of guidance. But there's a lot of guidelines there, ideas, meal ideas. And then go through our blog. I have a library of incredibly valuable information for you for free. I have been researching and researching for years, and you're going to see like all the research that I've collected from various sources, which include the types of parasites that are found in MS, but also the changes in the chemistry of the body. And of course, this has nothing to do with autoimmunity, right? It's just like something else is going on, and it's the parasites. So I have that for you. I have the diet for you. And if you need support, we have a proven plan, the Live Disease Free plan. You would just watch my masterclass training and then fill out a form and then chat with me, and you can get started today, or not today. Today is kind of late, but you can get started tomorrow if you like. So I'll leave that in your hands. You have lots to catch up on, and there is hope for you. There is a better way. There is a possibility, a real possibility of recovery, only if you treat the cause. And this talk that I did today about how diabetes medications is making significant improvements with MS and other diseases, not just MS, really confirms that parasites are the cause, decreasing the food to the parasites, and because glucose is their favorite food, is the first step to recovery. But we can do that with diet that has no adverse effects. So with that, I'm going to let you guys go. If you enjoy what I'm sharing with you, if you find it helpful, if you want to help us to spread the word, because this information is suppressed a lot, please like, share, and subscribe. It just helps to push it out to other people. Otherwise, I will see you next week. Take care and bye-bye for now.